Similar to what we've seen with the exchange, with the notice of benefit and payment parameters, CMS, every year, they issue regulations that impact Medicare Advantage plans. This year, the regulation came down at around the same time the exchange regulation came down. I want to point out 3 things in the regulation that relate to network adequacy that I think you all should keep on your radar. So the big headline with this rule is that CMS is going to require that health plans demonstrate a compliant network at the time of application for initial and service area expansion applications. And so you're going to have to demonstrate that at the time of application, but there will be a 10% credit that you will get during the application period. So you will get a 10% credit, and essentially we'll have to show that you are compliant with 90% through the application process. But when the contract year starts, you have to be 100% compliant with the network adequacy requirements. In addition, what we saw with the final rule, and this was different than what we saw with the proposed rule, CMS is going to allow health plans to use letters of intent during the application process. So instead of showing those executed contracts, you can show CMS, I have a letter of intent with provider X to enter into a contract. And you can use those. You have to notify CMS that you're going to use them. But again, when the contract year starts, you can't have LOIs in place. You've got to have the executed contracts in place. In addition, any plan that uses LOIs through the application process, they will have to engage in their triennial network adequacy review in the first contract year. So that's another important thing to keep in mind. But we have big changes coming at the QHP level, the exchange level, and big changes coming at the Medicare Advantage level as it relates to network adequacy. And so what we see here is really CMS taking on more stringent regulations in both areas.